So this could be the foam rolling section of our exercise video. We're looking at improving your flexibility, improving your mobilization. We all get tight with time. As we get older, we get tighter, and therefore we lose our flexibility, and therefore we lose our balance and agility. So I really want you to maintain that. People talk about static versus dynamic stretching. Static is okay, but it really doesn't help you that much. You want the combination between the static and the dynamic soft tissue massage to soften the tissues, increase the flexibility, and therefore improve your agility. And so I think the foam roller is a great way to do it. Depending on where your issues are, you can also use a tennis ball or a paddle tennis ball for different areas in the back. If you have soreness, you can lean against the wall and do a deep tissue massage to the area. If it's an upper or lower back or buttock area where the piriformis is, you can lean into it, and that can help improve the blood supply, decrease any scar tissue or loosen up any scar tissue to help improve that. I also like this type of foam roller, which you can see over here, but also the handheld foam roller. This one is better for the large body parts, and so we're going to be stretching and doing flexibility exercises for the thoracic spine, for the rear deltoid, and for the shoulder as well as the low back. And we're also going to stretch the whole myofascial sleeve around the leg, including the hamstrings, the IT band, the quadriceps, and the adductors. These three I want you to do with the foam roller, this one, and the adductors I want you to do with a handheld foam roller. So we're going to start with it on the ground, and we'll go from there. So first thing I want you to do is I want you to lay down on the foam roller. You're going to put your back on it. You're then going to bridge up, and you're going to slowly roll back and forth with your arms overhead. And what it's going to do is it's going to release your facet joints. As I go back and forth across it, I can feel my facet joints open, and it decreases that curvature of your spine, the kyphosis, and it helps open it up to basically increase the flexibility of your spine. I can feel my facet joints cracking as I go. I do this every day, and it helps to mobilize my spine, straighten my spine, and then that enables me to stand straighter. I then also go to my side and I do the posterior deltoid to try and loosen the scapula and the periscapular muscles so that your scapula can be much more mobile. This can be used anywhere in the body, but I like it for this location especially. For the patients who have trochanteric bursitis, we also recommend using it for the whole myofascial sleeve of the leg. So the first one that we're going to do is going to be for the hamstrings. Then we rotate all the way around with the handheld being done for the adductors. And so you do it each side. So I'm only going to demonstrate one side for now, but I want you to try and do it. It is somewhat difficult. It is hard on your hands. So if you have difficulty or weakness in your hands, you may not be able to do it, but you can try to modify it to try and improve your symptoms. So what I'm doing is I've had the foam roller transverse. My legs are going to be crossed, so I'm going to be stretching my right hamstring at this point in time. So the way you stretch it is by bending it forward. I'm lifting it up, and I'm leaning forward to stretch the hamstring, and I'm taking my buttock off the ground, and I'm rolling back and forth very slowly. There are different muscle groups, the medial and lateral hamstrings. My medial are more tight, so I roll toward the inside and I softly go across it. I do not go down to the knee because when it gets down to the knee, you get the neurovascular structures, and that can cause some significant pain. So I really want you to get the muscle group as well as the tendon, but not down to the popliteal fossa. And I'm rolling back and forth to do all sections of it to try and really soften it up while I'm doing the aggressive stretch to it. I then switch over to the IT band, and this hurts very much. This is for that trochanteric bursitis. Because the IT band goes from the iliac crest across the hip and across the knee, it crosses two joints. So as you walk, it basically snaps back and forth, which causes tightness and the bursitis in this area. The way to stretch it is the band has to be stretched from distal to the troch all the way down to the knee. So I'm stretching it while I'm doing it, and I'm foam rolling back and forth to try and soften the tissues, to increase the flexibility, and therefore to decrease the pain and stress on the trochanter. It takes a while to get this soft, but I want you really to work on it hard. If it doesn't work out, or if you need help, we can give you an injection at the trochanteric area, and that can help you out. Following this, I roll onto my stomach and stretch and do a soft massage to the quadriceps. And so that can help soften the quadriceps as part of the myofascial sleeve. The adductors would then be done. So the adductors complete the process, and when you're stretching the adductors, you have a handheld foam roller that you'll then roll across it to try and soften up the tissue of the adductors. So that is the foam rolling exercise for now.